Hi, I'm Associate Professor Heather Brooks and I work in the Pathology Department here at the University of Otago. I'm going to tell you about our Bachelor of Medical Laboratory Science degree. So this year, 2020, has been really important for us because many of our graduates and some of our undergraduates have been at the forefront of COVID-19 diagnosis. It's the medical laboratory scientists who carry out the DNA-based testing that distinguishes between patients with coronavirus and those who've got things like influenza. But medical laboratory science isn't just about testing for viruses because it covers a whole range of diseases such as cancer, heart disease, meningitis, diabetes. And it's a fact that 70 to 80% of the diagnoses made by the medical doctors are dependent on laboratory testing. And without these tests, there would be far more wrong diagnoses. And if you want to know where that leads, just look on the internet. Or maybe not, it's a bit gruesome. But anyway. So the medical laboratory science degree takes 4 years. In the first year, you'll study health science papers. The second year, some general health science papers, but you'll also begin your medical laboratory scientist training. And you'll get to know the other students in the course and your teachers who are going to help you achieve your full potential. In the third year of the degree, all the papers are focused on medical laboratory science and you'll be taught by experts in the field. And in the fourth year, you'll undertake workplace training through 2 15-week clinical placements in medical laboratories, and they're scattered around New Zealand, or you can even go overseas to do some of these placements. All right, the question on everybody's lips, will you have to sit exams? Sorry, yes you will, but it's not all exams, and quite a lot of work will be internally assessed. Okay, what can you do with your medical laboratory science degree? So about 70% of our graduates get employed in the medical laboratories to do the diagnostic testing, but there are lots of other career options. You can work in the biotechnology industry, maybe running clinical trials for a pharmaceutical company, working for a scientific instrument company, or veterinary pathology. A lot of our graduates go into medical research, some into forensic science, and 2 of our graduates have become mortuary scientists, which is a bit unusual, but anyway. And it's a great degree. If you didn't get into medicine the first time round, you can apply as a graduate with our degree. So there's lots of reasons to study medical laboratory science. My own reason, well, I love medicine, but I never want to give a patient a physical examination or tell them they've got a terminal disease. So I've had a great course, first as a medical laboratory scientist, then as a researcher and as a teacher.